Let's have a look at some of the special features that Invisalign provides for Invisalign features for teen patients. Now, right now, there are over 8 million people who've been treated with Invisalign aligners, and out of which a study done in 2016 said there were almost 270,000 were teens. Of course, the number is much more now. So the proportion of the teen patients is growing everywhere around the world. So what are the special Invisalign features for teen patients? Like I showed you in the first case, there's eruption compensation, which is given when you have a tooth which is still not erupted and you want to keep enough space for it to come into. You have the terminal molar tabs for second molars, compliance indicators, which you can ask for actually any case. And of course, the solution for mandibular protrusion, which is the mandibular advancement. How do you ask for eruption compensation? So when you submit your case as a teen, on number 12 in your prescription form, you will get the eruption compensation feature. You can ask for either none, or you can also add eruption compensation. You can even specify the size that you want. And a tip here would be to add 2 millimeters to eruption compensation from what you ideally want in the mouth, just to have a little extra space because the tooth might come in a bit rotated. Also, you have the tab for terminal molar tabs, and you can specify whether you want to give it for 6, 7, or 8, and at what stage you want to start with the terminal molar tabs. Now, when you don't have a tooth which is erupted and you have a contralateral tooth that is erupted, the software uses the size of the contralateral to automatically give you an eruption compensation space. For first premolars, you can also, like I said, you can specify the size also that you want for eruption compensation in your special instructions. This is how the eruption compensation looks like in the new ClinCheck 6.0. We don't have a teen tool, but we have a separate eruption compensation feature. When you click on it, you'll see your eruption compensation feature in your ClinCheck. And this is given for both canines and first and second premolars. In your treatment overview chart, the symbol for eruption compensation is this. So when you one thing I suggest is always open the Invisalign treatment overview chart that you get in the box and look at all the features that you have been given to you, just to understand what mechanics you are using during the course of treatment. The terminal molar tabs, like I said, these they extend over the mesial cusp of the terminal molar and they help prevent supraeruption of the terminal molar. And you can ask for them to be given at a certain stage. In the treatment overview chart, they are visible as these diagonal lines. Compliance indicators. Now, this is something that we use for a lot of teen patients, especially when the parent or the patient, or especially the parent, is not sure about the compliance of their own child. You have to pay a little bit extra for each set when you order for a compliance indicator for that set. It appears as a blue dot. On day 1, it is bright. On day 3, it becomes lighter. And on day 14, if it's a 14-day wear, it almost fades. Of course, now we do 7-day change. So it does still stay blue, but it becomes less and less and it fades at the end of the week. So when your patient comes to visit you, you should ask them to bring the last few aligners so you can compare. Is the amount of fading of the compliance indicators the same, or is there a variation? That means if it's faded more than the current one, that means he's either not wearing some aligners as well as the previous ones, and you can get a tab on how well the patient is wearing the Invisalign. So these basically are blue dots, and they fade as a result of coming in contact with the patient's saliva. So even if your patient tries to kind of remove them, they cannot be removed, right? Usually they're placed on the buccal surfaces of the 6s, but its location may vary. And like I said, once your patient wears it 20 to 22 hours a day, the color gradually changes from dark blue to light blue. Now, 70% of